Mondays with Dr. O. How's everyone doing?
Fine.
Good, good. Um, I'm not sure who's controlling the screen. I don't have access to the Zoom screen, but I do have the agenda for today. So we will get started. And the power of prevention is our topic. We're going to talk about routine health maintenance, dental health, disease, and health wellness. I'm going to be joined by Dr. Toyin Opensami. I so apologize. I do not want to pronounce your name incorrectly. And she's the MD of American Academy of HIV Medicine. And I'm looking forward to an exciting conversation about our health with her. Are
Thank
you
you.
there?
Thank you
Hello?
very much, darling.
Thank you. And
Um,
my apologies, pronouncing your name. It's
you did very well.
Opasani.
You did very well. Thank you.
Thank you. Thank you.
Um, Welcome, everybody. And before we go on, I have to apologize that Dr. Jennifer Jones is not here this evening. She's going to pop in. We have a clash in scheduling, but she will be in at some point to say hello to everyone. She said to apologize and to say that she's missing you. Thank you for another evening of medical education. Um, and I'll give it over to Dr. Ajagbe tonight. I will not belabor things. I will mention, though, before I ask Dr. Ajagbe to come on, that we are talking about routine health maintenance, that is maintaining good health. And it is important to do the preventive things before things happen, before one actually gets sick. Because once you have a disease entity, then we have to work on, treating, curing. But if we prevent, which is what we do best in medicine, then you avert that um, trauma and dilemma of what could be. A lot of people actually now are listening and they're doing the needful to do the preventive care. But most don't know the connection between dental health, oral health, and general health. So we are blessed tonight that we would have um, Dr. Ajagbe, who has been in dentistry for over 30 years, chief of pathology at Howard, and a teacher of teachers. I've heard him talk, and I think we're in for a night of amazing new things to learn. So before we go on, I'll give it back to Darlene in case she has any comments.
We have some background noise. If I could ask to mute, that would help so that this is being recorded. So, in talking about the topic for providing care for vulnerable communities, let's dive into some of the discussions around a global vision health center and providing medical missions in the United States and abroad.
Global Vision Community Health Center actually sprung from Global Vision Foundation, which Dr. Ajagbe will be speaking tonight, as participated in international missions with us. We do comprehensive national health preventive care as well as international care. We go to Kenya, to Nigeria, and just offer care to the underserved in order to bridge health disparities. And that's part of why we're here tonight. Learning about one's health is really bridging the disparity in knowledge that we may have relating to our health.
Yes, yes. So can you tell me, I don't want to, if he's muted, and I
Dr.
apologize.
Ajagbe,
Yes,
he's ready.
he's
Come
ready.
on, Dr. Ajagbe.
Hello, hi, how are you, sir?
Wonderful.
I tend to be particular about the pronunciation of everyone's name. So I apologize in advance if I do not pronounce it correctly, but I should have practiced before because your name is important. Yes. So please share with our audience the work that you're doing with regard to the topic of global health, specifically your initiatives um, for health maintenance, and particularly.
Well, let me thank all our guests tonight. Thank you for filling in for Jennifer. Uh, I think you'll do an excellent job. We are. I'm very confident that we are here this evening for a treat. Uh, I've put a lot of things together. Looking forward to sharing. Um, So thank you for all our guests that showed up to this evening. I know it's not very convenient for many people because of the time zone thing. Some people are 5 hours ahead of us and they still stayed up to be able to join us tonight. So we wouldn't want to take that for granted. We want to say thank you to all of you because I believe it's a sacrifice that many of you made to just be part of this program tonight. Yes, as Dr. O has said, we have partnered in many ways in terms of healthcare programs locally, and we've traveled to different countries for, medical dental mission. The last one that we went to before COVID-19 was one of the biggest that we've ever done. That we saw 7,500 people in about 5 days, and that was a huge turnout of participants, and they were all blessed. Nobody was turned back without being served. So we have good track record of reaching out to those who are suffering, reaching out to those who are underserved, more importantly, to those who have been forgotten by their governments. And so part of the things we're still doing is trying to educate, because I think the bulk of our job as providers or medical providers is to educate for most part, because if we gave prescriptions, and many people will even use the prescription wrong. So many times we have to spend time to educate. And that is the reason why I want to applaud Dr. O for the initiative of Medical Monday, which is what we are participating in tonight. And it's going to be the same every Monday for as long as the program runs. So I'm very proud of what Dr. O and the team have started, and I'm glad to join them, being co-presenter and as well as participant as an audience. I haven't received an invitation just last week to participate today. I went out reaching out to all my contacts globally, and I'm very impressed that many people gave their accent that they will be here tonight. So being here tonight is not just for us to have a good time, but I think it's enlarging the coast for the medical mission, because I can tell you there are people who are going to dial in from Australia, from Britain, from other parts of Europe, Canada, and other states. And Nigeria, in fact, that is one interesting place that everybody that is participating is sacrificing to be on. So I want to applaud them for that.
Yes,
You, sir.
And I thank everyone, all of our guests here, and thank you, sir, for everything that you're doing in the field and to support providing information on health maintenance and disease prevention. It's very important. And so moving right along, I'd like to introduce some of our other guests. So I have Miss Laura Famakinoa. Did I say that right? Oh, please charge it to my mind and not my heart. I should have been practicing on the pronunciation of everyone's name. So
You did good. Don't worry.
how are you today?
I'm doing well.
Good. Well, welcome. I'm so happy to have you here. Jennifer sends her best. I'm happy to be able to sit in due to a scheduling conflict. Please share with the audience and all of our other guests here, the work that you're doing with regard to our topic here, Medical Mondays with Dr. O, and health maintenance and disease prevention.
Actually, darling, if I may interject,
Oh,
Ms.
yes.
Zara is a guest and a guest of Dr. Ajagbe. So we're going to have Dr. Ajagbe go into his presentation because that's going to be the core of tonight's message. And I just want to say that, you know what, we always have reasons to thank God. Because of COVID, we have Zoom. And because of Zoom, we can have people from Australia, Nigeria, Canada, the UK. I have not seen Dr. Ajagbe in over a year.
Wow.
Until last week when I saw him on Zoom. And, thank God for Zoom. Thank you so much, sir, for always being there for us, for always being available when we call on you to help. The last mission he was talking about, Dr. Ajagbe, I don't know how he did it with his team. He extracted 200.
No, 2,000 teeth.
No, I mean, I wanted to say you average 200 tooth extractions a day. Is what I wanted to say.
200 tooth extractions a day?
Yes.
Wow.
To the point that by the end of the week, he didn't say anything until the mission was over, that his hands were actually swollen. He could hardly make a fist. I just want to say thank you so much, sir. We all appreciate you. And the floor is yours, sir. Thank you, and welcome again.
Yes. Thank you and welcome. And wow, what a commitment to serving and helping people. That's quite impressive. I've had a lot of work in my mouth, so I can only imagine that many extractions. So.
All right, let's dive into tonight. Let me quickly share with you, the audience. There are some news items that are very important that I need to share. Because we're talking about oral health impact on systemic health or general health. There are certain news that can be, very exciting when we hear it. The first one is to note that CDC just published that more than 80%, there's a more than 80% decrease in HPV infection seen in women, girls aged 25 and younger. I think that's a very exciting thing. And the reason I share that is the fact that oral health, there is no way you're talking about HPV without talking about the mouth. So I can tell you, we see a lot of HPV in different forms in the mouth. And so that was a very impressive news that I wanted to share as we go along. Another news that I think is very important is the fact that NIH just published a report that actually COVID-19, the virus, they've discovered that actually infects the oral cells, the cells of the mouth. And that is incredible. I mean, this was just published last Thursday. And so now they're advising us to pay attention to that. But while the results of the COVID infestation of the oral cells is being published, we also have another result of another study that is actually hailing two mouthwashes that can actually halt oral, infection of COVID-19 in the mouth. So just for this, for a quick, I don't have any interest in this product, but Listerine is one of the oral mouthwash that they found that actually inhibits growth or infestation of cells by COVID-19. Another one is chlorhexidine, which is what we normally give to patients for, gum disease. For patients that have chronic gum disease, we usually, after doing deep cleaning, we give them chlorhexidine mouthwash in order for them to prevent, the infection along the way. So I thought those three items of news could keep us on track for today. So I'm going to share the screen with everybody. Hopefully you can see. So the goal tonight is to actually talk about the impact of oral and facial health on general, or what we call systemic health. Let's go over quickly what that means. There are connections between the mouth and the other parts of the body, whether we're talking about in health or in disease. Nobody can survive without that have developmental abnormality. The mouth is still very functional and very useful in that kind of situation. So these are the ways by which the mouth is connected to other parts of the body. By eating, we all eat, we drink, we breathe. Not all of us breathe through the mouth, but a large population or large segment of the population actually breathes through the mouth. And we'll talk about that at length tonight. Talking and communicating just like we are doing right now, we need the mouth. Expression of emotions, entertainment, playing of instruments, and all of that stuff. And actually, the mouth has been used as instrument and weapon in this world. What do I mean by instrument? You've seen some people when they want to siphon gas from one place to another, they use their mouth. They use mouth to suck blood, in those days, to make sure that bad blood, as they call it, could be sucked out of people's body. Also, the mouth can be used as weapon, as in the case of biting people in defense of themselves. Now, let's look at what happens in illness. How is the oral environment or oral health impact the general health? We can see this from, I'm just selecting a few in order for us to be on track, because there's a lot of things to cover tonight. The first thing is dental infection. I'm not sure if everybody still remembers the case in 2006 of the Diamante driver, the 12-year-old Marylander that died from, dental infection, and it was a big news item, and because of that, certain policies were put in place. That was because this child was a mouth breather and had a lot of plaque, had dental infection. But because the mother was poor, they were denied because that was in Maryland. They were denied free dental health or access to dental care. And eventually, this child died uh, from complications of dental infection. He actually died from the spread of infection to the brain. And they did surgery. They tried to, manage the meningitis and encephalitis, but the child expired anyway at the end of the whole procedures. So dental infection should not be taken lightly. So anyone who has a cavity, you have a cavity that you've been ignoring for a long time, please, you need to do something about it. When the infection flares in the mouth, only those who have suffered the pain know exactly what I'm trying to describe without exaggeration. Sometimes some patients will tell me they really would rather lose their whole jaw than deal with the pain that they were experiencing. So I know dental infection can be very troublesome. The other thing that we would like to focus on in terms of correlation or impact of oral health on general health is breathing. Uh, the normal breathing is through the nose. Every one of us enjoy breathing. At the moment we have a problem, either from allergy or from cold or anything that causes the blockage of the nostrils, the default is to open the mouth to breathe. Now, we're going to go into that and see the differences between nasal breathing and mouth breathing, and why that is very important when we talk about oral facial health. Now, communication impairment. Well, if somebody has infection in their mouth, for instance, whether it is infection of the teeth, infection of the gum, infection of the tongue, the floor of the mouth, the lip, even the soft palate, the roof of the mouth, or any part, the cheek, communication becomes very difficult. In fact, many times when people have infection of the teeth in the back, they are unable to open their mouth. We call that trismus. And that is not very easy. In fact, sometimes the patients cannot even take any medication because they cannot open their mouth except by injection. I still remember one case that we saw in Abeokuta. It was like towards the end of the mission. This 12-year-old came, and unfortunately, the child could not open his mouth. There was nothing I could do to help him because, there was no hospital to admit him to do any kind of invasive surgery under general anesthesia because there was no way for. Um, anyway, so because that child could not open, the best we could do was to just give antibiotics and refer the child to the hospital. Unfortunately, the hospitals were on strike. So sometimes we can be faced by this kind of situation that, dental infection presents to us. Expression of stress. Many times we don't know that we are clenching our teeth when we're under stress. And until people have cracks in their teeth or they have chips in their teeth and they wonder what has been going on. Well, when we see them, we can always tell them that the way the teeth are wearing down indicates that they are clenching and grinding. And for many people who have been doing it for years, it eventually affects their temporomandibular joint, which is the jaw joint that allows us to open, that allows us to be able to chew, that allows us to be able to talk. Without the TMJ functioning properly, we will have problem opening our mouths. Now, inability to chew because of missing teeth and because of loss of teeth will often lead to malnutrition. And you can see a lot of people who are obese. This is one of the things that we discovered in dentistry. There are many people who are obese. Many of them have no back teeth. They've lost their back teeth. They are unable to chew properly. So most of the time they do not enjoy chewing. So they just swallow. And because they're not enjoying the taste of the food, and they just, trying to fill themselves up, they don't know when to stop. So inability to chew, either from toothache or missing teeth or fracture from injury, will always lead to malnutrition. And many times, if they are on admission, they have to be given nutrition parenterally. Now, cognitive and behavioral impairment. We're going to find out in a few minutes that when people that have underdeveloped jaws have crowding, their tongues are too big for their mouth because the jaws are too small, the tendency is that they will have breathing difficulty. And when they have breathing difficulty, they are unable to sleep because they are constantly stopping to breathe when they sleep, which we call the obstructive sleep apnea. Many of them, if they were young children, they eventually become diagnosed with ADHD. And many of them have problem learning. In fact, there's been found that sleep deprivation in children actually lowers their IQ. And we're going to see some of these things, the research in a few minutes. Now, connection between the mouth and other parts of the body can be, for today, in illness, we'll focus more on breathing wellness and breathing disorder. Before we get to the main part of the presentation, I just want to share some of the basic things that we do in dentistry. Some of the things we manage or treat in dentistry that we call oral health are under these categories: developmental abnormalities, decayed teeth, missing teeth, traumas, crowded teeth, parafunctional habits, tumors and cancers, oral manifestations of systemic diseases. Now, I'm trying not to use too many big words because I know we have people who are not medical who are our guests today. So towards the end, if there's any question, I'll be glad to address them. If there's anything that I've said that they couldn't understand.
Yeah.
All right, I'm going to show pictures of some of the common dental problems that we encounter in dentistry. Well, you can see the first one on the left is showing baby teeth. Baby teeth with decay already. The teeth are not crowded, but somehow the decay is starting between the two front teeth. Well, one of the things that we need to bear in mind is this: many mothers, they give their baby feeding bottles. And many of them, they use things that are sweet. They put soda in it, they put juice in it. And many times, this is what results from the sugar that is in there, whatever it is they put in the bottle for their babies. And here is congenital abnormality with missing teeth. Some of the teeth did not develop. And you can see even the bottom teeth were very weak. As of that age, the teeth have already worn. These are cases of negligence on the parts of the mothers or parents, you can see this is what we call rampant caries. When you see decay around smooth, surfaces of teeth in children, in babies, definitely it shows that the mothers are not paying attention. And the bottle, this is called the feeding bottle decay. And you can see it's not only in the front. For many of them, they can get it way in the back as well. Now, this is not unlike what we saw in Abeokuta. I saw a child, 8-year-old, that had 10 infected teeth like this. 10. 8-year-old. It was, I could not even, I had to just take them out for her because she was in severe pain. But she was very cooperative. I was able to take them out for her. Here, this is an example of pregnancy tumor. This swelling of the gums usually will come about the second trimester in pregnancy. And you can see the teeth are clean. They somehow, this mouth is not as clean as the one on the right, but you can see the teeth are very clean. So it has nothing to do with the fact that the mother had poor oral hygiene, but there is hormonal factor in this situation. So in this situation, any little irritation between the teeth can cause this growth. And as soon as the baby is born, even if nothing is done, these lesions will disappear. It's pregnancy tumor, we call it. Some of the things we encounter in dentistry normally is child abuse. You can see this is a child that has been given a fractured jaw. Definitely that is not from a peer, that's not from another child, that must be from an adult. But that's not uncommon to find in pediatrics. For those of us that love bone, we love oxtail, we love goat meat with bones. You better be careful when you're biting down on those delicious meal. Remember, these teeth, they have some weak spots. And the weak spots is usually the groove between the high points of the teeth. And you can see what happened when the tooth was taken out. You see how the tooth fractured all the way down to the roots. So sometimes a little piece of bone jammed in that little groove right here will act as a wedge to separate the two halves of the tooth. And that's what creates this type of fracture. That is not a pretty sight. It's very painful for those who have gone through that before. Well, on the left, sometimes we see patients that whether they were playing sports or they were running, they hit something, they fell, or it could actually be an abuse also that causes the fracture. You can see this is a young child that's just having the permanent teeth coming out. And for that to have a fracture already, either from play or from an abuse. Here's another kind of case that we see. I'm sure you must have met people with this type of appearance. They have a tiny tooth like that in the front. They may have two of them like that, or one may be missing. Well, that is congenital, that's developmental. It's not something they did wrong. All right? This is not unlike what we see all the time in dental practice. When patients have some missing teeth, this is also a child. Some of the baby teeth are still there, but this tooth is missing. The x-ray showed that this patient did not have a replacement in there because it didn't form. Okay, on the right, That is a very good example of a big dental infection. You can see it doesn't look like the cavity is big. There you can see the big swelling of the gum. That is a big infection. And that tooth, even though it doesn't show a big sign of big cavity, will have to be taken out in order for you to treat this big abscess. For those who have old fillings, these fillings used to be very, very strong. Many times they are stronger, many times they are stronger than the real tooth structures themselves. So when we put such fillings in, and the dentist does not remove all the decay underneath, many times there is what we call recurrent decay. And once you have recurrent decay, these fillings that are very hard, they act as wedges. And the patient can bite down on their like regular chewing, and that can cause the crack of those teeth. As you can see, you will see a few of those in the next few slides. I've seen a lot of patients like this with this type of chip. Sometimes it's very difficult to understand how they have a symmetrical type of chipping. It's almost like something fits in there like a pipe. Sometimes we see that with people who are habitual pipe smoker. Usually it will be on the side, but this is pretty unusual in the front. Now, this is the kind of fracture I was talking about earlier. It's similar to the one that we saw before that we did the extraction. You can see that split has taken place right there. And that could be very painful. Once this is split, you cannot truly chew on this tooth anymore. Anything that gets there will separate them, and that will cause discomfort. Here's another old filling that is acting as a wedge. If you look closely, there are cracks already at the weaker points of that tooth. These are some of the other things that we do see. Here is a case of tongue tie. Now, this is a big problem, but many people don't do anything about it. They think that's the way their life should be. But this is a very simple procedure that we can do. With simple local anesthetic, we can snip this and the tongue will be freed. Now, the problem with not treating this is you can see the gap. That child will have a problem as it grows up. There will be a gap between the lower teeth in the front, and it will keep getting bigger as the tongue gets bigger as well with the age of that individual. On the right is the opposite of this. Here you have a tongue that didn't completely fuse together. So now you have it looking like a reptile or reptilian tongue. We call this bifid tongue. It splits into two like the tongue of a lizard or snake. Well, sometimes we do see cases like this. This is a very mild case of clefting of the soft palate, primarily in the uvula. Uvula is always one, but in this case, it is not fused all the way together. So there are two left and right uvulae. On the right is a very severe case of clefting of the mandible. That is, the lower jaw did not fuse in the middle. And so the tongue is, occupying the space between the two halves of the lower jaw. Okay, so we talk about dentistry. It is best, when we talk about oral health, it's necessary for you to understand that it is not just fixing teeth, because most of the time, people call us names. They call us tooth doctor. You know, they call us Dr. Elenyi in Yoruba, and you know that you smile because it shows that people don't fully understand the extent of what the dental profession is all about. Anyway, just to give us a quick overview, we do have different sections or departments, if we can call it that, call them that. The section where the diagnosis are done, where people will go first, the first people to be seen will be those people who are in the diagnostic sciences. They will be the ones to see you in the clinic. They will do the x-ray. They will review the x-ray. If there's any test that needs to be done, they will be done. And then they'll propose treatment planning. Sometimes it may be just medicine, or they may have to be done in other departments like oral maxillofacial surgery. I'm sure many people know about that. That is where all the difficult extractions and jaw fractures, lacerations, that is injuries to the face, to the jaws and the tongue, anywhere else in the around the mouth and the surrounding tissues will be done. Prosthodontics is where we talk about replacing missing parts of the jaw, either replacing the missing part of the jaw or just the teeth uh, using appliances or prosthetic devices. When we talk about endodontics, that is the section that deals with root canal. So let's say you have a tooth that has been bothering you, but you don't want to lose the tooth. You do not have fracture in the tooth. You do not have chips in the tooth, but but you do have a cavity that has gone into the nerve. The nerve is infected. The tooth is dead. You could tell the tooth is dead by the change of color. So when you see the change of color and you don't want to lose the tooth, we do have a way of saving that tooth for you, and that is by doing root canal. Now, root canal is still viable for teeth that are not very fragile. The moment you take out the root in a tooth, the tooth becomes more brittle. And that is something that you need to bear in mind when you say, oh, I just want to save my tooth. I want to save my tooth. Well, the dentist has to decide whether the tooth is strong enough to go through that and to carry the weight of new restoration, which may make the tooth to actually crack and become useless. Periodontics is the area that deals with the gums. So when you have gum infection, you have, periodontitis, you have gingivitis, and it's all going on and on. Wrapping up on endodontics, I said many times people just want to save their tooth. They say, oh, please just save my tooth at all costs. I said the dentist will have to make that call, because when they look at the tooth and say, if I put something heavy on this tooth, the tooth is going to crack anyway. So why do you have to waste your money on doing the restoration when you know it's going to fail? So that's why I'm saying that uh, for those people who will say they just want to keep their teeth at all costs, they have to bear that in mind, that there could be, uh, a poor prognosis for that decision. The periodontics I was talking about, gum infections. Those are when you have chronic gum diseases, either gingivitis or periodontitis, and they're basically the same except for severity. Periodontitis is when you actually have deep pockets around the gums, around the teeth, in which case the bone is already lost. And that is when sometimes people can feel their teeth move, when they put pressure on their teeth, and they can feel there's a little movement, even though they can stay there, well, they can still manage their teeth. Now, sometimes the deep pockets will have to be treated by surgery. They will have to cut the gum, the excess gum off in order for it to be easy to clean around the neck of the teeth. Orthodontics, everybody seems to know about orthodontics. Orthodontics is when people wear braces. You don't wear braces without having malocclusion. Malocclusion is when you have crowding, excessive spacing, uh, when teeth are misaligned. You know, you may have beautiful set of teeth, but they are crisscrossing. Orthodontics help to treat, to put the teeth in alignment.
Mhm.
And I'm sure everybody has been watching the TV, you've seen the ads of so many aligners that are being advertised. I'm not advertising any of them, but some that is for treating those teeth that are as a result of underdeveloped jaws. Maxillofacial orthopedics, well, is a new aspect of dentistry that is offshoot of orthodontics, but it's using totally new, approach in order for the teeth to be aligned. But the focus primarily is to grow the bone, not just moving the teeth, but growing the bone so as to increase the space for the teeth to have, for all the teeth to have space without overlapping each other. So now let's move on to.
Dr. Agnew, you have several questions. I just wanted to know if you want to wait till the end of your presentation for some of these
All right.
questions.
Okay. Can you just read the questions to me
Sure,
so I can?
absolutely, absolutely. So we have the
Yeah.
first question, and also I want to be mindful that I believe we have a hard stop at 8:30, but Dr. O, you can text me, message me for that. So the first question we have is, how many times do you recommend brushing your teeth and flossing every day?
Okay. All right. That's a very straightforward question. But I think if I answer this, just say 2 times, 1 time, you forget. And then you don't know why you're doing what you're doing. The question I always ask people is, why do you want, what do you want to clean?
Mhm.
So if you know what you want to clean, so you know how you want to clean it.
Thou hast shed blood abundantly,
Hello?
and hast made great wars. Thou shalt not build an house unto my name, because
I
Hello?
apologize. Go ahead, Dr.
Okay.
Agnew.
So let me just briefly say, well, if based on what we normally tell is brush twice a day, brush in the morning, brush in the night before you go to bed. Now there's, in fact, last week, there's a publication that is saying that people should now delay brushing till after breakfast. So you see, things are constantly changing, but the reason I say that, I normally will ask the question, what do you want to clean? Because if you know what you want to clean, then you know how you're going to clean it, how you're going to keep it clean.
Right.
Plaque, simply, let me just use this opportunity to describe that. Plaque is nothing more than what you see like cream cheese. Everybody knows what cream cheese is. If you use your dish or a china, very clean, expensive china, you use it to eat something that has cream cheese on it. If you clean it right away, would you need a scorer to clean the cream cheese from the plate? No.
Right.
You would not need anything harsh to clean if it is just fresh. If it's fresh and you're cleaning it, you get it off. There's no need to spend so much money to want to clean cream cheese from a dish. You understand?
So if I
Use the same analogy to your teeth. All right. If you wake up, if you brush every day, and the new plaque you get in the morning It's just the fresh one that came from yesterday. Why would you need a scorer to clean it? Because it is very thin and is very soft that can easily be removed. So if you want to do 2 brushings a day, that's fine. It's not going to spoil anything. If you're going to do it once a day, but you do a good job, you will find that by the time you wake up in the next morning, you don't even have plaque or much plaque on your teeth. So technically, we'll say twice a week, twice a day, in the morning and in the evening.
Okay, thank you. What do you think about teeth whiteners? What do you think about
Okay.
using teeth
All
whiteners?
right. Tooth whitening. This is the thing about tooth whitening. Many people think as soon as they put some whitening stuff in their mouth, their teeth will be like chiclets. No. Everybody's teeth are different from others. And there are no 2 teeth in your mouth that are identical in texture and in color. I mean, you can look in the mirror and you'll be shocked. And then if we're going to do whitening, we have to educate the patient that what your expectations are to be reasonable expectation. Because if you come and say you want chiclet white, the first time you have a whitening is not going to happen. Some of your teeth will be whiter than others with the same whitening. Whitening is good for some people whose teeth seem to look uniform, because then when you see it, you don't, there won't be any kind of any tooth sticking out like sore thumb, because you can see some teeth are not going to be as white as the other ones, while the ones that are going to be white are going to be exaggerated. Whitening should be taken with care. It is good if you can afford it. It can be very expensive if you want the one that is done in the dental office. But if you try the ones on the over the counter, now most of the products are competitive, comparable to each other. So if you buy from Crest, or you buy from Pepsodent, or you buy from Colgate, it doesn't matter. If you buy from a third party that doesn't have a big name, they are all using peroxide. The peroxide we use for whitening is called carbamide peroxide. If you are using hydrogen peroxide on a daily basis, you are actually whitening your teeth on a regular basis. You don't even know, but it's not going to damage your teeth like if you use a very strong carbamide peroxide to whiten your teeth. So my thing is, if you must whiten your teeth, know everything about what you're about to do so you don't get totally disappointed, because you put so much money out there and it's not going to give you the result. For those who must have really white teeth and you have the money, we could do things called serenade, which is like veneer. Veneers will make all your teeth uniform, but it's expensive. You can spend $1,200 for each tooth. And if you're going to do it, you must do at least 8 teeth in the front, so that when you smile, nobody is seeing the back teeth. That at least from premolar to the front, people will see you smile. So if you're going to do 8 teeth on the top, you must do 8 teeth on the bottom. That's 16. Multiply that by $1,200. That is not cheap. So
no, it's not.
yeah.
So would you recommend just to wash your mouth out with peroxide?
If you're using hydrogen peroxide like I do every day, I'm not preaching against toothpaste, but I don't use toothpaste.
Okay.
I've not used toothpaste for many years. And I tell everyone that is close to me, you don't need to use toothpaste, because what you're trying to take care of, hydrogen peroxide and baking soda will take care of it even cheaper for you, and they will give you fresh breath every time,
Okay.
because there's sugar, there's sweetener in toothpaste.
Yeah.
And what we're trying to do is we're preventing plaque. And you're having sugar in your toothpaste, you're eventually going to get plaque. So it's like a vicious cycle. You're going to keep getting that. I can go 2 days without having any plaque on my teeth from one brushing. And it's not because I'm a dentist, it's because the baking soda is slightly abrasive. It will dissolve. It's not like harsh, ceramic particles that are inside the toothpaste. So for me, if I want something abrasive, I'll use the baking soda without any moisture on it. So it's just the practicality, and I've been practicing for 40 years.
Okay.
So I know what I'm talking about. It may not be popular with the manufacturers, but I know what I know. And they can't tell me I don't know what I don't know. So.
Well, after all of those years of experience, I think we all can trust what you know. There's a number of questions I want to go through that kind of tie in. One is how does diabetes affect your teeth? I think you spoke a little bit about that when we were talking about the sugar.
All right. So there are different ways by which diabetes affected the teeth. Well, we can look at it from, which one came first, diabetes or the teeth. For the child or the person that has crowding, that all the teeth are all overlapping and the tongue is crowded, and the person cannot sleep well at night because of sleep apnea from developmental abnormality, definitely it's going to affect every system of that person's body because of this sleep apnea. Obstructive sleep apnea will predispose the people to having cardiovascular problem, cognitive problem, diabetes, and every other chronic diseases. So when somebody has diabetes, how does it affect the teeth? All right. So let's say somebody never has sleep apnea, they has diabetes. How would it affect their teeth? Diabetes will affect healing of the gums because of the way the disease processes the pathogenesis. It affects healing of oral lesions, particularly gum disease. So they generally will have more frequent inflammation of their gums. And when they do, even the common treatment we give to them doesn't seem to work because they are not healing properly if their diabetes is not controlled. So the most important thing is that if they have diabetes, they must see their primary care physician, manage their diabetes, and their gums will be healing properly. So if they do not control their diabetes, their teeth will become loose from loss of bone. See, when they have gum disease, they lose more bone than normal person that doesn't have diabetes. So it is best for them to control their diabetes to preserve their bone. Now, more importantly for women who are towards menopause, if they are already in the menopausal stage and they have diabetes, that is double whammy. They're going to lose more bone, and many of them are going to lose their teeth if their diabetes are not under control.
Oh, thank you so much for explaining that. it sounds like that diabetes is important to control, not just for your overall health, but definitely for your teeth health, your bone health as well. So this is good information. I did get a question that wanted to understand the ratio of baking soda and peroxide. And so based on everything that you shared, this is excellent information. I'm just gonna go out on a limb here and ask the question. My grandma used to say, to me when I was little, you want to brush your teeth and keep your teeth white and clean, use baking soda and wash your mouth with peroxide. So based on that, the ratio of baking soda and peroxide, are you recommending that's good oral hygiene?
It's simple. Honestly, it is as simple, and I think that's why people stumble on it, because it's so simple and easy. They feel, it cannot be that easy. All you need to do, simple, take your toothbrush, when you rinse it, shake off the excess water, pick fresh baking soda with that. You will see it on your toothbrush. Put a swig of hydrogen peroxide in your mouth and swish around. Spit out excess, have enough in your mouth that will make the baking soda foam in your mouth. When you do that, you are getting not only detergent effect, you are having an abrasive effect that is not damaging to your enamel. It will make your enamel smooth and fresh and shiny. Not only that, the two of them together, we use them to control odor. So now you use that to brush your tongue very well. And you use a little bit of hydrogen peroxide to rinse after you've used the baking soda and peroxide to brush before you use water to rinse your mouth. I'm telling you, if you have gum infection, you will get relief. And people don't want to hear that they can get simple relief from baking soda and hydrogen peroxide. All the most difficult patients that I had with gum disease, that is their go-to. Once they use chlorhexidine, is not working. They've taken oral antibiotic, is not working. I tell them, we gotta go back to baking soda and hydrogen peroxide. And the reason is simple. Hydrogen peroxide releases oxygen. The oxygen is what destroys the bacteria that are anaerobic. So the anaerobic are those microorganisms that survive without oxygen. They love lack of oxygen. But when hydrogen peroxide releases oxygen, they explode. They're done. The population is reduced. And that is the population of bacteria that cause the decay, the gum disease, and bad breath.
All right. Well, you heard it here first. So I have a few more questions. Let me ask you, it sounds like this might be the solution, but how can one stop bleeding of the gum? The recommendation that you have here, is that also one of the ways we could stop bleeding?
Let's put it this way. Bleeding from the gums can have different reasons, different causes. The first one is vitamin C deficiency. If somebody lacks vitamin C, the first area they will show it is in their gums. And that was what we used to call scurvy in the past. Okay, so scurvy is still back.
Okay.
And the way scurvy shows up also is very strange. If you've been taking very high doses of vitamin C and you stopped, your body will see it as a deficiency because your body has adjusted to very high level of vitamin C. And so if you stop suddenly or you go low, your body will see that as though you are having a deficiency. And you will have sore gums and you may have bleeding gums as well. Now, that's number one. Number two, if you have calculus under your gums, you may not see it above your gum, but it's under your gum. It is a constant irritant to your gum tissue. You will have inflammation. And when you have inflammation of the gums, you will have bleeding. There is no way you can dodge that. Now you can smile and everybody sees that you've bleached your teeth are clean, but you are bleeding every night. You wake up, there's blood on your pillow. There is something that you need to check. Now, if you have that cleaning done with a dentist who does a deep cleaning for you, you would need a way to heal. And part of the way to heal is to use warm salt water. That would be what we tell you to do first 5 days. I mean, 5 times a day. Many people will shy away from it. I do only 2 times. Well, you know what you want. If you don't want healing to be effortless, then you disobey whatever the instruction is. But if you do the deep cleaning and you use warm salt water 5 times a day, the gums will heal. The swelling will go down. The bleeding will stop. It's just like that, without even using baking soda and hydrogen peroxide. But I will maintain it. If I was the patient, I will maintain it with hydrogen peroxide and baking soda on a regular basis. And I can tell you, I don't have any gum infection. I don't have any gum inflammation at all.
Awesome. Well, I really appreciate you taking the time to answer these questions. What I'd like to encourage everyone else that's joined in, that they may also unmute. If there is a question that I did not ask or I did not see in the chat, please unmute yourself and feel free to ask that question, or if you have a comment or feedback for the doctor on this presentation.
Well, I'm glad you're asking that question. I mean, you're asking them to do that. That was actually what I wanted to do first, to say, is there anything important that anybody wants to know about? So we can talk about it before I go into something else that might be more technical. So
yeah, all of these questions, all of the questions that I asked, they had placed in the chat. So I was just, I wanted to make sure they were doing that while you were doing your presentation.
That's fantastic. I appreciate
please, I'd love to hear from other people.
I have a question.
Mhm.
Does teeth bleaching cause teeth sensitivity or gum sensitivity? And if not, what does? And the second question is, hydrogen peroxide, I understand, creates some spottiness on the teeth. Is that true? And if not, what will cause that when you use too many hydrogen peroxide with the combination of the baking soda?
Okay. All right. So thank you very much for the questions. The first one is, what causes tooth sensitivity with bleaching or whitening of teeth? All right. If you have cavity, the cavity in the teeth means if you put the chemical in your mouth, the chemical will go close to your nerve of the tooth and it's going to cause irritation. So for people who go to get their whitening stuff, OTC, that is over the counter, without getting a checkup before doing their whitening, yes, they are likely going to have sensitivity. Then if they do not have cavities, but they do have gum recession. What I call gum recession is when your gums have moved away from the neck of your teeth. It means the root of your tooth or your teeth have been exposed. And the moment your roots are exposed, even to cold water or ice cream, you will have sensitivity, let alone putting carbamide peroxide. Now, most people that go to buy OTC, they want to buy the extra strength so their teeth can be quickly whitened. Well, the stronger the concentration or the higher the concentration, the more likely you're going to become sensitive, even if you don't have gum recession and you don't have cavity. So what causes sensitivity is some disease already on the teeth. If the diseases are taken care of, for instance, if you have a feeling done, if you have a cavity and you have it filled, the chances are that you won't have as much sensitivity after whitening your teeth. Now, for those who choose to buy the strong ones online, you go on the internet and you see the so-called third party or no name type of product, and they are selling what is not controlled. They're not controlling it. They're selling the very therapeutic grade over the counter or by email or by whatever means. When you use those, you burn your gums, because when we do it in the office, we protect your gum with some kind of resin. We paint it on your gums to protect your gums when we put the chemicals on your teeth. And you don't do that when you do it at home. So the gums are going to get burnt by high concentrated carbamide peroxide. So, and then we, in the office, we also apply desensitizer. So when we do the bleaching in the office, we also have a chemical that we use to desensitize the teeth that will not change the color from what we just bleached the teeth as. So it's just a question of, say, do I want to do it by myself, DIY? If you want to do it on your own, well, you must assume all the risks that go with that.
Well, thank
Now, the other thing is hydrogen peroxide and baking soda, do they create white spots? No, they do not create white spots. Hydrogen peroxide, if it whitens your teeth, it will do it uniformly. The
Okay.
reason people have white spots is simple. They have incipient decay. The decay is just starting. When decay starts on teeth, it will look like chalk. It will not be transparent or translucent. It will be chalky white patches on the teeth. Now we see that same chalky spots on children's teeth because they have excessive fluoride in their formula, they have it in their vitamins, they have it in everything. And all the time, by the time the teeth are growing and the adult teeth show up, they will have all these white patches on them because of high level of fluoride in their teeth. It's a form of fluorosis, but it's not a severe type of fluorosis. For Dr. O and those people, if you've seen people from Kenya or people from East Africa, that they have all kinds of colors of their teeth. And it's not because they've taken tetracycline when they were babies. It's because of the high level of fluoride in their water. In their natural water, they have very high levels of fluoride. And so you see the whole community, and it looks like they are all from the same parents because their teeth are the same, brownish, mottled color. You see different shades of brown, and they don't have any cavity. They won't even have cavity because they have too much fluoride in their teeth, and their teeth are resistant to having decay. So hydrogen peroxide does not create the white patches. If white patches show up, it means the white patches are already there. The hydrogen peroxide just making it brighter. So I will not, it's just that if I showed my teeth now, you won't even see how white it is, but there are no white patches on my teeth, and I've been using hydrogen peroxide and baking soda for not less than 15 years.
Yes, thank you so much. I do want to take a moment to congratulate and announce our winner for tonight, Miss Vera. My apologies that I do not have your last. Oh, Miss Vera Ndum, Ndum. Congratulations to you. You are our winner. You will receive a $25 Amazon gift card. Lots of things to buy on Amazon. Also, I want to remind everyone that we do have a hard stop at 8:30. However, we want you to hang out with us, what we call the after Zoom party, where you'll get to have more conversation, ask more questions, and allow Dr. Ajagbe, I think I said that right, to share more information from his presentation. I saw in the chat there were some questions around dry mouth, and we have someone I'll also put
Oh yeah, actually, it would be nice to talk about mouth breathing.
Dr. Ajagbe, for
Yes.
1 minute, please. I just want to congratulate Ms. Vera again, but wanted to mention that anyone who brings 10 or more guests to the forum becomes a VIP, and we do present them a gift every week. Hannah has been a winner for the last 2 weeks, including this week, but she decided graciously to defer a gift to Miss Vera Ndum. So congratulations and thank you, Hannah, for just the amazing person you are. We appreciate you all. Thank you. And on that note, Dr. Ajagbe, I'd like to ask a question. In the beginning, you said HPV infection in the mouth. HPV, human papillomavirus, which is something we see in the vaginal area or genital area that causes warts, that causes cervical cancer. That's why we do pap smear. You see a lot of it in the mouth.
Yes.
Now, is it because of oral sex?
It's part of that. But see, there is before it was associated with the genitals. It was primarily diagnosed in the oral cavity. So for many years, it was not the virulent variant of HPV that causes, all the complications in the cervical area. It used to be what we would call, warts, white sponge nevus type lesions in the mouth. It would just be white lesions. And when we do biopsy, we look for the cytopathic changes in the epithelium. And so when we see that, we see the HPV inclusion bodies right in the nucleus. And that's how we used to diagnose it. We never associated it with any malignancy or anything, but it was just like, cause a viral lesion. Pretty much like when we see herpes type 1, you see the mouth used to be where the herpes used to be. We call it fever blister. Everybody had that tiny, tiny blisters in the corner of their mouth, on their lip. Then at some point, it became something that is associated with sexually transmitted disease. The same thing with condyloma acuminata. Condyloma is a verruca wart. It's the venereal wart. We see that in the mouth as well. We see a lot of that. In fact, I saw a lot of that with patients that had HIV infection when it was very florid. I saw not less than 12 patients with venereal warts in their mouth. And when they have it, it's everywhere. It is everywhere. It's on the tongue, it's on the gums, it's in the throat, it's everywhere, floor of the mouth. You couldn't even cut one off, and you just we use cryosurgery to, to freeze them out. But it was just an interesting sight. Yeah, HPV. That is why I said for us to be talking about it in dentistry, because that was the Academy of General Dentistry that put out the CDC report of the HPV reduction by 80%. And that was like, wow, we were seeing it in the mouth all the time.
Good. So I know that I want to just reiterate, if there are any questions or notes or health concerns, or you need any additional information, please send an email to medicalmondaysdro@gmail.com. We will stop at 8:30. We'll have a short 3-minute break, and then come back at 8:33 with questions, and allow Dr. Agbe to continue. Dr. O, did you have something that you wanted to share? Okay.
Dr.
No.
O.
Looking forward to the second to the after.
Absolutely. And I just want to applaud to see the people coming in. It's very exciting and heartwarming to see all of the people joining in to get this information about maintaining their health and preventing disease. I'm excited to see this on a Monday evening. So I applaud all of the people who have shown up, because that says a lot that you are invested to maintaining your health and being able to share this information with others.
Darlene,
Yeah,
hi, this is Caprice. I have one question, if I can.
sure, yes.
I wanted to know, Dr. Arby, about head and neck relationship to oral care and HPV.
So you ask about HPV and head and neck.
Yes.
Okay. So the HPV, the normal, well, if I could call it normal, the benign one that we used to see was always like on the lip, on the tongue, or on the roof of the mouth. But now the HPV, similar to the one that is found in the genital area, has not just stopped in the mouth, but it's gone even to the throat, to the point that you could see some in the pharyngeal area, you could see some in the back wall of the pharynx. And so it's the same way, the same kind of treatment that they will have to be given. We in the dental office, we do not talk too much about the vaccination against that, because we assume that the primary care physicians will be addressing that aspect of prevention of HPV. That is all I can say about the presentation of HPV in the oral and the perioral area. Do you have any, does that address your question?
Yes. Thank you so much.
You're very welcome.
Caprice, I just want to also make sure that we confirm it's Vera is the winner.
Yes.
Yes. Okay. All right. So we'll take a 3-minute break and then come back. Next phase.
The after show. Thank
The
you.
after show. Thank you.
Welcome back, everybody.
Thank you.
So we're going to go on with the questions. Dr. Ajagbe, are you ready, sir?
Yes.
So.
All right, please, you have to be asking the question. I don't want to be reading and making questions that people have.
We don't expect you to read, sir. I was about reading a question to you, sir.
Okay, good.
Somebody was asking how many times to brush teeth and floss a day.
All right, so I would say that technically speaking, anytime you eat and you have something between your teeth, use a dental floss to get it out. Don't use toothpicks If you don't have dental floss, find some. And I try to tell people, they now make it very easy. They have the plastic one with the dental floss already put there and then has a sharp point at the end. That is easiest to use. So if you have anything between your teeth, it's best to use dental floss to take it out. Now, if it's just about cleaning your teeth, like just how many times do you have to floss to clean your teeth? Well, I normally will floss before I brush because that's the logical way it works. Some people will say, well, why don't you floss after? To me, the logic is simple. If you have plaque between your teeth and you already brush everywhere else and then you now floss, some of the plaque will come onto the teeth that you already brushed, and it's because of the gummy nature of plaque. So I will do flossing before I brush. So if I'm brushing twice a day, I will floss before I brush my teeth. So so I'm just saying that if you know you want to brush twice a day, then floss before you brush. So that would be two times.
Yeah, there's another question about what about someone that brushes their teeth at least 2 times per day but still have bad breath? How can this be corrected?
Okay.
Then I have a follow-up on that. Can baking soda and hydrogen peroxide be used for children or it's meant for adults?
Okay. All right. So bad breath usually comes from poor hygiene. That's usually. I say usually. Some people have bad breath because they are dehydrated. If you are dehydrated, you will have bad breath because there will be less salivation, and saliva is what keeps our mouth from actually washes the bacteria. As we swallow, we keep swallowing the bacteria, and the acid in our stomach do the justice on them. So if you are dehydrated, you will have bad breath. Now, if you are a mouth breather, there is no way you can avoid that. If you're a mouth breather, your mouth will be dry, and when you are talking, your mouth will be filled with saliva. You've seen people that are mouth breathers. When they are talking, they have saliva everywhere, and then when they are not talking, their mouth is dry because their body is trying to compensate for the dryness of their mouth when they try to talk. Now, some people, if you are taking medication, if there's any medication you are taking that is causing your mouth to dry up, yes, you will have bad breath. Now, if you eat pastries, you eat bread, you eat anything that has carbohydrates, sugar, and then you have a period of time in between meals that you don't do anything, you are sitting in front of the computer and all you are doing is typing away, you're not talking to anybody, well, you will have fermentation of the carbohydrate in your mouth, and that will bring about, some form of bad breath, which we call halitosis. So hydrogen peroxide and baking soda will help you a lot. If you do a good job of brushing your tongue when you wake up with hydrogen peroxide and baking soda in the morning, even if you eat after that, you will have less fermentation in your mouth because the acidity is being neutralized by the baking soda. The baking soda is an alkali that will neutralize the acid. The baking soda is alkaline, so it will neutralize any acid that forms from the bacteria breaking down the carbohydrates in the mouth. So that's usually the case. And the acid that is released from the carbohydrate is what causes the decay of the teeth, particularly if you have plaque buildup and then you still have acid under the plaque, you have decay, definitely, with that. Now, is it only good for adults? No, it's not only good for adults. You know, everything, even antibiotics, you have children's dosage. You have to use less amount of everything. You can dilute the hydrogen peroxide 50-50 to use for the child. And we're not talking about a glass full of of hydrogen peroxide. All you need to do is just the little cups, the little paper disposable cups. You can put a little bit of hydrogen peroxide and add water to it. And I think it's going to be useful for children as well. You use their same toothbrush. And if it's a toddler that does, you can use cotton buds with baking soda.
There's another question about your thoughts of oil pulling with coconut oil.
All right. I laugh because my own daughter actually asked me the same question. Say, well, what do you think about oil pulling? And I would say, well, oil pulling, I would say two ways. Oil pulling is not being proven, scientifically in any
Can
way.
you explain what that is, please, to people who don't understand what oil
Well,
pulling?
oil pulling is when people will take a little bit of oil. Some use coconut oil, some use linseed oil, some use olive oil, some use different kinds of oil, black seed oil. They use anything that they believe will pull bacteria out of their cavity. And anecdotally, they say that it worked. The reason I would say it works is simple. Bacteria cannot grow in oil. So it's not like it's going to disinfect the tooth. It's just that when oil is in the mouth and you're swishing it around, particularly in the area where you have a cavity, the bacteria doesn't have what they need, the sugar and everything that they need to break down to release the acid. So that in a way is kind of like a protective thing, not a therapeutic approach. I don't know of any mechanism to describe how it pulls out the bacteria if it does, because the only way we could prove that would be to take the spit of the oil that is spatted, is it spat out or whatever, that you spit out, and then try to do a culture from there and see if there is enough load of bacteria to support, that the bacteria in the cavity actually has been pulled out. So for people that use it, it is nothing hazardous, and I don't have anything against it. But if there is no scientific evidence to say this is how it works, we would just be guessing, just like so many other things that we'll be guessing. And people say anecdotally that it works, so be it. In the past, people use the clove oil of clove. I don't know if you've heard of that before. Oil of clove is the same thing as eugenol. It is very good to control toothache. Not touch and go that is sold in Nigeria. If you use touch and go, it will damage your gums and damage other things. But if anybody has toothache and they don't have money to go to see a dentist, and there is nowhere they can get dentists, and they have toothache, do not put aspirin. Do not put touch and go. Go and look for oil of clove. And if you have clove in your cabinet, You can make a small paste of that and put on in your cavity, and it will calm your toothache down. So about oil pulling, I believe it works for those who believe in it. So I can't tell them not to do it because it's not harmful to do it.
Thank you, sir. How often do you recommend changing toothbrush?
I change my toothbrush once every 3 months. And the reason for that is if you use it properly, the bristles should not just become, divergent or spread out within 3 months if you use it properly. Because the reason I was asking earlier about what are you cleaning? Because if you know what you are cleaning, then you know the tool you need to use to clean it. If all I'm cleaning is plaque, I'm not trying to clean stain, I'm not trying to clean calculus. I don't need a locomotive type of force to get the plaque off of my teeth. More so if I'm using hydrogen peroxide and baking soda, I don't need much force to get it, to get my teeth clean. So I would say changing it, if you use 4 toothbrushes in a year, that's not bad. Now, but if you are the type that within 1 month, your toothbrush is already going in different directions, well, please change it. Or if it is 1 week that you use it and it became like that, because I think the key is if it's no longer effective in cleaning your teeth, why keep it? Because if you brush one time and let's say you spend about 5 minutes brushing, which is a long time. Let's say you spend 5 minutes brushing and you run your tongue over your teeth and you still feel some roughness, it means you haven't done a good job. It doesn't matter how much force you use. If you still feel something still on the surface of your teeth, it means your teeth are not completely clean. Tomorrow's plaque will adhere to that much easier. And if it continues like that, it will build up because you see people who say, but I brush twice every day and I still have a lot of tartar buildup. What is wrong? What am I doing wrong? Well, if I use the analogy of eating kenke or fufu in a plate, and you wash it, but you still leave a little bit of fufu on your plate, and you put fufu next the following day, and you wash it, and the 2 layers of fufu is still on your plate, and you didn't clean it properly, and the third day you use it, and in 1 week you'll be using spoon to scrape the fufu from your plate. It's the same scenario with your gums, with your teeth. If your plaque is not removed completely in a week, let's say 7 layers of plaque is left on your teeth, definitely they will absorb calcium from your saliva. The calcium ion in your saliva will make the plaque to become hard. So that's why you can't use the toothbrush to brush it anymore. Once it gets to a point.
Miss Josephine Larea.
Yeah, good evening, doctor.
Good evening.
I was asking how effective is the use of cinnamon oil in the prevention of tooth decay.
Well, cinnamon is a spice and it's anti-inflammatory. It also has antiseptic effect. So if you use cinnamon oil or even cinnamon powder, it could stain your teeth over time, but it will still do the job of preventing bacterial growth. So you could use it if that's what you prefer to use. But why use something that will stain your teeth long term? Can you hear me?
Yes, I usually will put just like 2 drops of the oil in my mouthwash mix.
Well, I mean, what mouthwash do you put it inside? You
I
said
use a natural,
mouthwash
it,
mix. Mhm.
it's a natural mouthwash mix that I buy.
Well, do you know what it contains?
Um, I actually don't have it with me, so I can't read
Well,
out
okay, so
all the.
this will be my suggestion to you.
Mhm.
If don't overkill, because
Okay.
you still need some bacteria in your mouth. Because if
Okay.
you don't have enough bacteria in your mouth, the fungal growth will increase. You will get
Okay.
yeast infection in your mouth. So that's
Okay.
why you don't use broad spectrum antibiotics for too long. If you
Okay.
do, you will end up with yeast in your mouth.
Okay.
So you still want to maintain balance.
Okay.
What we're trying to do is to, subdue the real bad bacteria, the one that causes gum disease, the one that causes cavity, the one that causes bad breath. If you can lower the population enough to the point where you are healthy, your mouth smells good all day long, and you don't have cavity, you don't have gum problem, you don't need to spend extra money to try
Okay.
to do something because it's doable. I mean, that would be
Okay.
the way I would do it, because if you
Okay.
are mixing too many things together, you may be
Mm-hmm.
overkilling.
Okay.
But I will advise you to check what the mouthwash contains
Okay.
before you start adding other things to it. If it already contains a lot of things that is doing the same job,
Mm-hmm.
just that would be just overkilling it. And
Okay.
then the other thing I will advise is, if you can, avoid buying mouthwashes that has a lot of alcohol in it.
Okay.
Alcohol, long-term use of alcohol in mouthwashes have been linked with oral cancer. So
Okay.
it's best for you not to get yourself exposed, more so if you are going to be doing it long term. If you're
Okay.
just going to do it once in a while, maybe not. But if I was going to use any mouthwash at all, I would not buy anyone that has alcohol as part
Okay.
of it.
Okay.
Okay,
Thank you very much. That was very helpful.
you're welcome. Ephraim, you have something.
Professor, good job.
Thank you. You have a question?
Listen, I'm going to ask a question that was already asked in the chat earlier on from Vinci. She's asking a little brief on root canal and dry mouth.
Okay, so root canal. When do we do root canal? Let me see if I can share. Anyway, let me just explain it. If a tooth has a cavity, every one of us knows what a tooth looks like. Wherever the cavity is, it doesn't matter. Once the cavity gets to the nerve and the nerve is infected, the tooth becomes painful. So when it becomes painful, sometimes so people will complain, anytime I drink something cold, it hurts me to the brain. If I drink something hot, it hurts me to the brain. So when a tooth gets to that point that both hot and cold hurt, it means it's on its way out. It's almost dying. So if you can do anything at that point, the dentist can, if you go to dentist, they will try something to try to save the tooth so you don't do the root canal. But if you waited until nothing can calm down the toothache, that is, you use ibuprofen, You use all kinds of painkiller, is not helping. And it keeps you awake at night. That is, you think your heart is beating in your mouth, because every time your heart beats, you feel the same pain, the same pulsation of pain in your mouth. At that point, you can no longer save that tooth in terms of saving the nerve inside it. It has gone to the point that we call non-reparatory, pulpitis. So it's irreversible at that point. The only thing that can be done if you want to keep that tooth is to do a root canal. Now, if the cavity was so big that the crown looks like eggshell, the best thing is to take the tooth out. Because if you do root canal and you put a crown on it, the chances are that the root is very delicate. And the plug that we put inside the root canal to put the crown on top will act as a wedge that will split the root. And so many people end up having root canal done and they regret it because it doesn't last. Because when you put weight of a crown and the abutment into a root canal that is very delicate and is very brittle, the only thing that will happen is it's going to split. There is no way to dodge that. So that's the one for root canal. Root canal can help a tooth, particularly a child who just have a tooth and then had a fall and chipped off part of the tooth. Well, the tooth is still vital. If the fracture goes all the way down to the nerve, well, root canal has to be done. In that case, that child can still keep that tooth because everything else is strong in the tooth, because it was not because of decay that the tooth is infected. It is because of trauma. That tooth can be built back up and it will function like normal healthy tooth if it's restored properly. So root canal is useful for teeth that can be saved, not teeth that are already so bad that you just want to keep anyway. If you do, you will waste your money. And, if you are the one paying, then no problem. But if the dentist tells you this tooth is too bad to save, don't argue, just let it go, because, you will come back and you will still have to take it out. Now, dry mouth. I think I mentioned a little bit about dry mouth. The people that get dry mouth the most are the mouth breathers. And you will see them, their lips are habitually ajar. That is, their lower lip and their upper lip never come together. And most of the time, because their lips are called incompetent lips, their teeth, their upper teeth will start sticking out between their lips. When you see that, you know that they are mouth breathers, and most of the time they have allergy, their nostrils are blocked. Sometimes they have a sinus problem. The moment they start mouth breathing, there's problem. The air that is going into the lungs is no longer sterile, because the nitric oxide that comes from the sinuses sterilizes the air that goes into the lungs. And that is why when we breathe normally, we generally do not have infection of our lungs. But if people breathe through their mouth, they will always have lung problem. That's number one. And when they mouth breathe, they are because they are constantly having dirt, dust, and everything going into their mouth, the tonsils and adenoids and they will become huge. Now remember, these people, their nostrils are already blocked. They are breathing through their mouth, and the tonsils and the adenoids are huge. They cannot sleep well at night because the only way they can get air through to their lungs is through their mouth. So they will be waking up, they will be having the apnea, and they will be having intermittent waking up, arousal, and then going back to sleep, and then waking up, because once they stop breathing, their brain will arouse them again to start breathing again. Now, those people will always have dry mouth. Their breath will always stink. They will always have heavy accumulation of plaque. They not only will have heavy accumulation of plaque, they will have calculus, they will have everything. They will have gum infection, they will have cavity, and that was the case of Diamante Driver, the 12-year-old that died in Maryland because of dental infection complication. So for primary care physicians, Dr. O, when you see any child or any adult that is a mouth breather, they need help. The help they need, we know, is not just because they need to breathe through their nose. Most of the time is because they have crowded teeth, because their tongue may be too big for the space, because their jaws did not develop. They need to grow their jaw, and we have ways of growing the jaws now. Before there was none, or there was, but people didn't look into it, because orthodontics, using the wires and the braces, seem easier than the other one, than the one that grows the jawbone. But there are patented devices now that has been approved by FDA that we call biomimetics that actually simulates physiological bone growth. So it's much safer. It may be more expensive, but it's much safer and it gets the job done. The job is done and it takes care of three things. It takes care of the sleep apnea permanently. They do not have to use any CPAP or any more device. Once their jawbone grows to normal size, they will no longer be mouth breathers. So they will not have constant oral problems that is associated with that.
The question in the chat that we didn't touch is the question about why people have sensitive teeth, what to do about it, and also why the teeth become sensitive after filling. If you can answer that in 2 minutes.
Sure, I can do that.
I'm timing you.
Okay, so the sensitivity of teeth after filling. Sometimes it depends on the depth of the cavity itself. If the cavity is very deep, anything you put in it without a liner will be sensitive. It doesn't matter whether you put metal or you put composite. What I will do is I will put a layer of dical, which is a calcium hydroxide. I'll put a layer of that to calm the tooth down, and that is one way to prevent the sensitivity. Or I'll put a layer of zinc oxide eugenol. Remember I talked about eugenol being oil of clove? The oil of clove will calm the tooth down and we'll put the composite on top. Now, what's the second question apart from?
Why do people have sensitive teeth and what should you do about it?
No, that's the one I just said now. The one about filling.
The one after filling is the one you said, just sensitive teeth.
Okay, if you have sensitive teeth generally, the chances are that you have gum recession, which means your gums have moved away from your teeth a little bit. If your root is exposed, definitely anything that goes there will make your teeth sensitive. Now, if you have a cavity that has not been restored, that have not been filled, yes, you will have sensitivity. If you have an old filling that has been there for 20 years, and you look in the mirror, the edges have been broken down, and you don't know what to do about it, definitely you will have sensitivity. So the best thing to do would be to go to see your dentist. Now, if you don't have cavity and your gum is not, you don't have gum moving away from your teeth, and you still have sensitivity, it may be that your enamel is becoming very thin because you've been abrading it with something very harsh over time. And the only way to deal with that will be to use, well, what is available is Sensodyne. If you buy Sensodyne toothpaste, you use it as directed, and peradventure it works. It works for some people and it doesn't work for some. So you just have to try what you have. Personally, I will go to baking soda and hydrogen peroxide.
Thank you so much, sir. Excellent session. Kindly remember to give information, to leave your information there. Some people are asking to have your information. Please, if you do that in the chat box,
All right.
so that people can
Can
have
I
that.
ask a question
So,
before you leave, please?
oh yeah, please go ahead.
Why do we have people grind their teeth?
Ah, okay. Grinding, okay. Part of the problem of grinding for people that do it when they sleep is this flight or fight, sympathetic response to sleep apnea. What normally happens is when people, it's like when somebody is feeling choked, they will do everything to try to get back their consciousness. And part of the way the body does it is to move the jaw forward. And the next thing is the somebody who is subconscious, who is sleeping, not knowing what is going on around him, will grind back and forth. And it's with force. What they are doing is to make the jaw move forward so air can go, because the tongue has fallen backwards. And to move the tongue forward is by chewing and by grinding forward. And that is kind of like a reflex that they are going through. Now, if you are under stress, in most cases, people clench without even knowing that they are clenching. They clench because it's another way of coping with their situation. Now, for those people who don't have the habitual clenching, the chances are that if two of your teeth are touching first, that is, one tooth is higher than the surrounding ones and is having premature contact with the bottom one, that you cannot avoid clenching in that situation because you do not have physiological neutral closure of your jaws. So in that case, you would need, let's say somebody that has crowding and one or two teeth are touching before the others, that has to be adjusted if the jaws have not been expanded. So you have to check the stress level of the person who has everything normal except that they grind. There must be something stressful that they are dealing with. There is no other way to explain clenching other than the fact that many people do it subconsciously. They don't even know that they are doing it until somebody gets their attention and say, you're grinding your teeth. And they say, oops. And some people, you don't even hear them, but you can see the muscles of their cheek constantly contracting, and the one of their head is constantly contracting. And you know they are not chewing any food or chewing gum. when you see that going on, you know they are clenching and they are grinding their teeth. And it's easy to recognize when you see somebody that's talking with you and it looks like somebody has filed all their teeth and they are all equal level, both the front and the back, you know they are grinding their teeth. They may not admit it, but they do. That is the telltale mark that we see in the clinic that they've been grinding their teeth over time.
Thank you so much, sir. Thank you for those for the information. Kindly remember to put your contact in the chat box, and please, if you have any other dental questions, contact Dr. Ajagbe or email medicalmondaysdro@gmail.com, and we will get the answer to you. It's been another amazing time of learning. Kindly join us again next week. Every Monday we'll be here and we will have medical relevant information for you, or medically relevant information for you every week.
God bless you. Quick one, please. I want to say that it's been an awesome time, just like you said. And if you will permit, can we do two things? One is to everybody to unmute their mic and give a drum roll to say, congratulations, work well done. Today, by God's grace, we were 90 participants.
Wow.
Good job. So let's give a drum roll to praise God.
Yeah.
God bless you.
Stay true.
God bless you.
Amen. Amen.
So I've put my cell phone number and email address. So somebody wants to reach me. That's what I.
Thank you.
Thank you all for coming.
Go ahead.
Does anybody want to ask any question? What is that?
No, we defer the questions to emails, or anyone can contact you directly. And if they email us, we will definitely get that question to you and get the answer to whoever asks the question. Yeah.
Absolutely.
So thank you so much for another day. And I pray that the Lord will keep us safe and bring us back safely next week. If you have specific interests, specific topics that you would like us to discuss, email us, medicalmondaysdro@gmail.com, and we will make it happen for you. If we have to bring specialists in that area, we'll bring them, but I can answer a lot of questions also for you and can have multiple conversations in different aspects of medicine. So with that, may the Lord keep us safe till we meet again next week. Good night.
Thank you all I want to thank all my guests that stayed up all through the night to participate. I see people from the Netherlands. I see somebody from Dr. Oludare, thank you for joining us.
Thank you, Doctor. Thank you, everybody. Have a blessed week, the rest of it. See you next week by the grace of God. Bye.